Good morning.
Thanks for putting the Zoom on, Melissa.
Absolutely. Thanks for joining us.
Sure, I've got a foot clinic going and I've been running back and forth and I knew I wouldn't make it over there. So thanks for doing this.
Absolutely. I'm glad that technology is good
Yes, it's great.
when it works, right? I may have just done a workaround, so hopefully the live option will continue to work for us. Liz was having that problem with it for the human services board meeting anyway.
Okay, the meeting will be broadcast for remote access on a live stream on YouTube. And then the address is there on your paper. This meeting may inadvertently cause a quorum of other county committees or the county board of supervisors. No business decision or any other committee or the board of supervisors will be conducted at this meeting. This meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the press in accordance with the Wisconsin statutes so that citizenry may be aware of the time, place, and agenda of this meeting. And we have a quorum.
We do.
And we have an agenda in front of you. Is there a motion to approve the agenda?
I'll make a motion to approve the agenda.
Moved by Carl, is there a second? I'll second it. And seconded. Those in favor of the agenda as presented, signify by saying aye.
Aye.
Hi.
It is approved. The minutes of the February 2nd meeting. For a chance to look at those and approve them as they have been handed out to you. We'll take a motion on that.
Mark moves to approve the minutes.
Okay. Well, hi, Dave.
Morning, gang.
Is there a second to that?
I'll second.
Okay, second by Carl. Those in favor of the minutes as written signify by saying aye.
Aye.
And it has been approved. Okay, public comment. Public comment. He's gonna bring the public.
I was gonna talk during the Make the Right Happen, but if that's all right.
That's fine.
Okay.
Okay, we'll move on. The transportation operations update.
Yes, so thank you, Carl, for your suggestion last time, in wanting to take a look at overall prior to COVID and bringing us to current day. What do the numbers look like? What do the rider numbers look like? And numbers are great. Numbers start to tell us part of the story, but numbers unfortunately don't show us everything, but they give us an idea of what the work looks like. And the reason that I say that is over the years, one of the biggest things I think that Jana has been experiencing over the years is the needs of our riders are increasing. The needs of our riders being, our riders are aging. Many of our riders need some extra help in coordinating with their doctor's offices, in verifying their appointment days, times, locations. Jana has a smooth operating machine behind the scenes, but there's an awful lot that goes into it to make sure that it runs smoothly, in making sure that everything is in line with one another. And Jana knows many of her riders very well and knows those extra tasks that need to be done to walk alongside our riders to make sure that they get to where they need to be. So when you're looking at the numbers from 2019, bringing us current to 2000 through 2022, you will notice when you're just looking at the numbers, we had over 11,000 total one-way rides, one-way trips in 2019. That's a lot of rides. Bringing us to 2020, nobody is surprised the pandemic really affected the number of rides that we were providing, as many things were shut down. Going into 2021, we were still working through COVID, and into part of 2022. We were still working through part of COVID. But what Jana was seeing as she was working with everybody coming out of the pandemic was the extra, the increased needs of our people, and what that was all entailed. So that's what I'm talking about when I'm saying that they're just numbers, but we're going in the right direction, definitely. We're getting there. We will continue to move in a positive direction. And continuing to do more marketing, in the way of letting our partners in the communities know about our services and who we're here to serve. I did a comparison, seeing the number of riders that we had and the number of drivers that we had. Another interesting comparison. The numbers here, not as big of a difference as the total number of rides from the previous chart. But you'll see in 2019, we had over 400 riders. Drivers, we had 34 drivers at that time. Going into 2020, we had 37 drivers and 327 riders. And as a result of the pandemic, we did lose some drivers, going down to 27 drivers. And 339 riders, again, going back in the positive direction for 2021 and also following for last year, 388 total riders with 29 drivers for those folks. Every month we continue to get new riders. That has been a continual growth that we have seen every month. Every month we see a minimum of 10 new people every month. And I have seen it go as high as 19 new people.
It's usually
in 1 month.
between 14 and 19.
So we're definitely making an impact there. And the ride type, the reason that I took out this data to show you is there are a lot of different ways that we capture our data for the different rides that we provide. And if I brought it all down and showed you all of the details that we provide, it just gets to be too much. So instead of breaking every detail out, I picked 3 data sets to look at. So these data sets do not represent the entirety of those total rides that I showed you up in that first block. So if you're going to add up those rides, they don't correlate with one another. And that's because I took out 3 categories to take a look at. That was all for comparison's sake. So you'll see that the 2 rides that are the most frequent across the board are our elderly handicap rides that we provide, which are the people that we directly fund through the 8521 Department of Transportation grant funding. And the second most common ride are those rides that we serve through community care. Community care is a category that we capture those managed care organizations that we work with for long-term care. That's Community Care, Iris, Lakeland, Inclusa. Those are all companies that are within that Family Care and Iris umbrella. So with these blue categories, those categories do not use our grant funding because we are paid 100%. We're reimbursed for those rides. So we bill those companies and they pay us back for those rides. But interestingly enough, though, the folks that are in that blue column are elderly handicapped folks. Those are folks that need long-term care and assistance. Just happens to be they have a funding source to pay for their rides. That's the difference there. And starting in 2020, what we started to do was track the number of veteran rides that we are providing. The reason that we're capturing those separate is because of that special veterans transportation grant that we started receiving. I think Leah applied for it for the first time sometime in 2019.
Around-ish, yeah.
We unfortunately, we don't have the data for 2019. The data is starting in 2020, and we're continuing to collect that data because we need to do so for that grant that we received to let them know how many people we're serving. So,
Those veteran rides
mhm,
started in 2020, tracking them.
tracking, we're
Mhm.
serving them all
Are
throughout.
they also included in the red and blue there? I mean, I'm trying to see if you
That is a good question.
if you just took them out
Mhm.
to see how many there were.
Jana, when you're booking a ride and you have a veteran ride, would you track them under just the veterans category, or would you also track them in
It's
the,
under EH as well.
it is under both?
The veteran category is when they are attending a VA clinic itself. So if they're going to a Theta Care or, Ascension, it would be considered EH. If that makes sense.
Okay, it sure does. Good question. Any other questions with any of this information?
No, I can give you a comment though, and that's, granted, I haven't driven since September, but. I know a lot of the veterans I've talked, in fact, just about any category. A lot of the people I've talked to still have no idea that our service exists. Cause I've talked to a lot of veterans, and boy, I wish I had a way to get there, well, call Jana. But a lot of people still don't understand, don't know. I know at one time we had talked about possibly getting some leaflets or something that.
And we did update those.
We did, we provided the drivers, the volunteers, like yourself, we did provide stacks of the updated brochures with the drivers, but we certainly can touch base with them with drivers and see if they need any more.
Well, the thing I'm getting at is that it'll probably be mid-May. I'm hoping I'll be back to work.
Sure.
And if that's the case, I don't
Yeah.
have any of this stuff.
We
What-
did
what-
also update brochures like with the assisted living places and
Mhm.
Theta Care
Mhm,
and some of the older adult communities and apartments,
mhm, mhm.
and along with our webpage.
I was gonna ask also, whatever happened with the seatbelt extensions and the pads?
We gave them out to a couple of drivers that are using them for clientele that they regularly take. So it's been a success.
Because I know in the past, I've had some people that there's no way my seatbelt would go. on.
Right.
That,
yeah.
in fact, that was why we brought it
Yeah,
up in the first. place.
Melissa ordered some and,
And you offered it to the drivers that,
right,
Would like
take-
them.
that handled them regularly.
and we certainly can always get some more.
Well, I'll get with Jana when I'm ready to come back and
Sounds good.
catch up with what I'm missing.
Sounds good. As far as getting the word out, educating people on our services, that's always going to be a work in progress. There's always going to be ways that we can improve upon that, and we're going to continually find different ways that we can make it better. But the important thing I think to remember is that we just keep trying and doing as many different things as we can think of within the funds that we have available to do so. Thank you.
Those, I'm gonna call them brochures, but they're little newspapers that come out periodically from DHHS.
Yes,
You're mentioned in there.
we do put articles.
And that goes in the
transportation.
buyer's guide. with
Yeah, Buyer's Guide, ADRC.
all of our
Connection.
People. I'll read that.
Mhm.
And one of the, we tried something new last year. Jana, instead of having the articles talking about just our straight transportation and the different types of rides that we provide, Jana published a story about a driver and rider story. And we got a lot of really great comments
Positive feedback.
from that story that we shared. Of course, we got permission from the driver and the rider before we published anything. They knew and agreed to being in our publication. We would like to do more of that. Making sure that we are having it be a special article though, and not having it be standard in every publication, but doing it once a year, maybe twice a year, of having a special story
Highlight.
to highlight our program. There's a lot of unique stories from folks of the program.
I had a blind lady one trip and I didn't see her again for a year and a half. And I got to talking with her and I said, I told her the story. And she's sitting over there with a grin because she knew what it was because she was there. But when I got done, she says, "You don't remember me, do you?" And I said, "No." She said, "I was the one that was there. What it was is I hit a deer by taking her home about 6:30 at night. And when I hit the deer, I got out of the car to call the sheriff's department and all that stuff. When I got back in, she said, "Well, what's happening?" Because she simply couldn't see. And I told her I had hit a deer and I had to call the sheriff and everything. And I said, "He's going to meet us in Manawa," because that's where she lived at the time. And when I got to Manawa, or on the way to Manawa, she looked at me and she says, she says, "When we get there, you tell that sheriff's deputy that if he needs a witness, to call on me because I'll be an eyewitness." And she had the greatest attitude in the
Yeah.
world. She literally stone blind. She couldn't see a thing, but she wanted to be an eyewitness. So just little things like that that in itself,
No.
a few of those make it worthwhile.
We have the best riders in Wapaka County, that's for sure.
Well, absolutely, absolutely. Thank you for that. So, quick update, as it relates to the Catch a Ride program. Jan and I have had meetings with Catch a Ride, and they are expanding quickly to being more than just employment transportation, which is fantastic. They're expanding now to providing transportation for folks to medical appointments and other rides that they may need that doesn't fall into the category of employment or medical transportation. So with expanding out, especially into the medical rides, we want to make sure that we are helping one another out in that if we find a rider calling Jana and it doesn't fit within the requirements within our funding and our funding source, that we're providing that warm handoff then to Catch a Ride to notify them of the rider to get them connected with their service. We also were talking about the reverse then, if they have somebody who's contacting them that they could serve through their program, but would be someone who meets our demographic area, asking that they give that warm exchange, that warm handoff back to us so that we can serve those folks as well, going back and forth. With the Catch a Ride program, they just last week acquired or purchased a handicap accessible van, which is going to be to our benefit down the road, being able to serve individuals that may be wheelchair bound, may have limited mobility and not be able to independently transfer in and out of a volunteer's vehicle. We will have the ability to use Catch a Ride as well as Make the Ride Happen, which we have been making contact and trying to make those connections with already. Will be nice to have one more option to do so. With Catch a Ride right now, their transportation is within Wapaka County. Some of the little bit more interesting conversations as we move forward with Catch a Ride is a lot of our riders have medical appointments outside the county. So our transportation requests when we're working with them is going to be not that standard $3 ride that everybody pays for a ride, but it would be more than that. And of course, the rider who's, if we do partner with the Catch a Ride program, say there's an instance where we are having them help one of our people, that rider will not be paying the fare to the Catch a Ride program. We will be partnering with Catch a Ride behind the scenes and taking care of the logistics of the payment so that rider still sees that same copay as it's advertised in our brochures.
Now, one thing that I've run into already with the Catch a Ride, and that's leaving the county for somebody to go to work. That's kind of the pits. It worked out that my son-in-law or my son and my daughter-in-law, both their cars died like 2 days apart. And they were both working in Point and they couldn't use Catch a Ride because it was going into another county.
So the grant that Wapaka County received is specific for help with employment transportation for Wapaka County. And with that, that funding is great, but that funding puts then parameters around how that money can be spent. But from talking to Jess, it sounds like there are potentially situations where they may be able to take somebody
Right,
from a Wapaka County resident out of the county, possibly. But their priority is to our
Wapaka County business.
businesses, yeah, that are right here in the county.
Because they live in Iola and they were both working in Point at the time.
Yeah. I think it's based on availability and then they look at mileage.
Did they use the app or call in, do you know?
I know that my son called because I told him about it and I got the phone number from, I think, Mary Kay Burke.
Okay,
She's somehow she's in, she is employed, I believe, by Catch a Ride.
she is, yes. I didn't know that that was her last name, but yes, I
I'm
know
pretty
Mary
sure her
Kay.
last name was Burke.
She's been at a couple of our meetings
Yeah.
that Jan and I have had with them.
But, you know, she was the one that told us about it. And of course, we're pretty close because of her dad and mom being involved in the VSW, me being in the VFW. My son's helped out a lot.
Those connections.
We all
Those
know each
connections.
other. That's how he got it. All I know is he called now, you know, just who he talked to or whatever. They told him that they couldn't because it was out of the county.
Do you recall how long ago that was?
Couple of months.
Okay,
And they're probably fairly new to it.
yes, yes. If anything happens in the future, I'm going to encourage people to continue to ask and reach out and see if their availability
Right.
has changed. That is a ever-growing organism that it's continuing to get bigger and bigger organically as more and
It's
more people
evolved.
have more of a need, more vehicles, potentially more riders. Their needs are increasing and they're gonna do what they need to meet that demand. So if it happens again,
I
give him a
don't
call.
think it will because they're in the process of moving to Point. So.
oh,
It's just something I wanted to bring up because I'm sure they're not the only ones that were in that situation.
no, and Jess from Catch a Ride. He told us that, yes, they do get those requests for transportation outside of the county and they do what they can, but sometimes they are able to accommodate and they're trying to do as much as they can within the confines of their program. So they are definitely trying, I can say that. They're trying to be as flexible as they possibly can be, which is great, because that's how you serve people, by being flexible. So yeah. First quarter, I do not have our first quarter report to share with you all for this meeting that right now it's in the process of being developed. That first quarter report is the report that we send to the 8521 Department of Transportation, where they see our funding and our riders and all of our total numbers for that first quarter. I can tell you that financially we are on track with our spending for this year, and we are on the rise for the number of riders that we are serving. We were over 500 rides for January and February, and we are well over 750 rides for the month of March. So we're 250 rides up for the month of March. January, you know, as we're getting into the warmer months now, we will again see a little bit of a change in people going out more, leaving their homes more, wanting to do more things. So that is first quarter, and that I'm just looking at my points here. That was what I had to report on. Janet, is there anything that I missed?
I did, just because I was curious, do a comparison from January, February, March, or just the last few years, just to see how we were doing for this year. It's kind of interesting. I just wanted to know for myself, but it kind of tells you how we did for first quarter. Oh, so, yeah.
So for first quarter in 2020, that was prior to the shutdown,
Yeah,
so
you can tell.
2020 would have
Isn't it interesting?
mirrored. It's
Yeah.
very interesting, would have mirrored 2019 very closely.
Yeah.
Yes, the numbers definitely tell a story. They definitely do. Not all of it,
Yeah,
but
yeah.
And so how are these rides different than the other chart we were looking at before?
Well, this was the whole year.
Oh.
Yeah.
okay.
This is just January, February, March, because that's all we could pull for
Yep.
2023. So
Nice.
I was just curious how we were doing for this year so far.
Yeah.
We're going in the right direction.
it's interesting to note that 21, 22, and 23, the month of March was by far
I know
the biggest.
people come out of hibernation a little bit more.
Yeah, and if it wasn't for the pandemic, 2020 would have looked the
Right.
same way.
Well, you
So,
know, and especially with our audience. You know, they don't want to go when there's ice or snow. They don't want to risk falling or, you know, and we don't either.
Unless those are
Yeah.
appointments that they have.
Yeah.
Yeah.
Exactly.
A
So-
lot of them I know, were afraid just because of the road conditions.
Right,
You know,
yes,
we might be professional drivers, you could call us, but at the same time, they don't know that.
safety definitely first.
Ready for the next one.
We are.
Update on Make the Ride Happen. So we continue to work with Holly and Shannon on those requests that we have for folks that could use transportation through their handicap accessible van. They have 2 vans. Those vans are located in Appleton. But those drivers of those vans, unlike the Catch a Ride program, the Catch a Ride program have paid drivers right now that they're using. The Make the Ride Happen drivers are volunteers. So when we have a ride request, Holly and Shannon touch base with those drivers that they have that are licensed or certified to be able to operate those vehicles. And they do all they can to try to meet that need for us. We are finding it is the most cost-effective way for us to use the Make the Ride Happen drivers for folks that are on the eastern side of the county. The Make the Ride Happen program starts charging mileage from the minute that ride leaves the parking lot that it's kept at in Appleton. So for the van to go from Appleton to Iola, to Stevens Point, back to Iola, back to Appleton, that is a pretty pricey ride. But when we're taking advantage of that on the eastern side of the county, having someone travel to the Fox Valley area, that is a cost benefit. So with these players, we're all together doing what we can to serve everybody. But what Jana and I are finding is that it is a delicate mix with all of us working together to make the dollars stretch the furthest that we can. So,
And you're good at that.
oh, we try. We try. So I just wanted to let you all know that although I was talking about the Catch a Ride program, we are still working with Make the Ride Happen. And I think that we will learn a lot over these next few months with the Catch a Ride program in their handicap accessible van. We have not booked any rides with them yet, right?
No,
Not with their
Not yet.
van.
I
Man, it's
refer
brand new.
people, you know, to them just
Okay.
for, in general, you know, if they haven't qualified or were interested in information on them.
Mhm.
But we haven't booked anything. Do you have a question?
I have, if it's okay, I'd like to add a piece in there. So at East Central, one of the things that we're planning for this spring is the coordinated, specialized transportation coordinated planning. And so that is where we look at all of the transportation options that are available in each county and write them into a plan. And WisDOT has given us new guidance this year on how we do that plan. And so that's, there will be meetings coming up later in the spring, early summer about, you know, how are people accessing transportation? And one of the big changes that, Melissa segued into exactly here is all of these different options and how do they work together? And how do we maximize people's awareness of those programs? And so we're hoping that the update to that specialized transportation coordinated plan is going to be a great resource for letting everyone know both on the planning level so that we can continue to request those funds and keep building that coordination that way. So that's going to be some public meetings coming up that we'll be working together to figure out where and when those make sense in the county.
And when those meetings happen, are they going to be meetings for just folks, paid staff in those programs? Are they going to be open to riders and drivers as well?
Those are for the community.
Okay.
So it's everyone who either uses or could use the program and has input, because we also want to find out from people who aren't using the program, why not? That's the other question we often ask in there is what are the gaps? What are all of the agencies? And we know during, the last 3 years, a lot of the agencies that provided rides have closed or changed or, shifted mission that way. And so, but then in Wapak County, we're fortunate here to have new resources developed and coming. So yeah, so I think it's gonna look very different than the last plan. And I think that'll be a very good thing for everybody. So we'll have more information about what transportation is available.
Wonderful. And that's done every 3 years.
Yes. Although again, with COVID, it's probably closer to 4 or 5-ish, but
Okay.
yeah, normally it's every 3. Yeah.
Okay.
Mhm.
Very good.
Then you got Kaplan that's got all his vans out there going to.
And we still use them and we still use Metro Ride out of New London, right?
Metro Transport.
Thank you, thank you. Those two companies, we're not going to be able to continue to meet the need if all of our rides are booked at that price point. Those rides are pricey. They have a business to operate, rightly so, and they charge accordingly. But if we want to have the handicap accessible transportation be a sustainable program and be a service that we're able to offer ongoing, we're not able to book all of our rides. We can't afford to book all of our rides just through Keppens and Metro Transport.
Reason I brought that up this morning when I was taking my wife into Nina, there was a Kaplan van. Probably came from up back down Highway 10. We both went to the same place. We both left the same thing.
Darn
But
it.
they had a nice little van where the back had a thing and the wheelchair came right out.
Wheelchair ramp.
Oh, yeah. Instead of from the side.
Yeah, this came out the back. I was surprised at that because it was like a small van.
Yeah.
Yeah, there's,
Do you guys know if either Keppens or Metro is qualified to do non-emergency medical through the state, through VAO/MTM?
I think
Keppens
Keppens does.
yeah.
Yeah, I'm pretty sure.
Metro,
I-
I don't know about Metro.
I don't know about Metro. I can forward his email to
Keppens-
you.
That'd be awesome.
Keppens have been in the past. I don't know what that recertification with the state, I don't know
Yeah.
what that looks like and how often you have to be
They must
a qualified provider.
Right.
They must have quite a few vans because I see them around our area quite a bit.
I'm not sure how many they have.
But like you say, it's costly there, I guess, because he's got to pay.
He has to pay those drivers. He has to pay for his
Yeah,
gas. He has to pay
vehicles.
for the vehicles.
And then like
Metro
everyone
has as
else.
many
they're
drivers
still
as
finding
Keppens,
drivers.
Right.
Oh, yeah, they got ads in the paper all the
Yeah.
time for drivers.
And I'm glad that you brought that up. Because there are times when Jana has a ride request and we don't know about that far enough in advance of that appointment. When somebody does need specialized transportation, that is a handicap accessible van and Keppens doesn't have an opening. Metro Transport doesn't have an opening. So we do run into situations where that, given that short notice, that those companies aren't able to help us. So it's going to be really interesting to see in the future is as we are, and we will continue to reach out to Make the Ride happen if they have volunteers that can help meet that need for those requests.
Like my driver was older than the patient, I think this morning.
Dedicated employee. But with the Catch a Ride program and having there be paid staff, it will be really interesting to see what happens when we do have some of those last minute requests.
Yeah,
It's going to be based on their availability. What Jess was saying, which is going to be really interesting, is his busy times are in the evening and early morning. But the times when our people have doctor's appointments, late morning, midday, they're really quiet. So they don't have
Yeah,
that many people
right.
that they're taking around. So this could complement
Be a
one
good
another
balance,
really,
right.
really well.
ours is pretty much 10 to 2.
Well, I imagine the big problem is that night thing, isn't it, when people get let out of the hospital at night.
It can be a
Gotta get
barrier.
out.
It can be a barrier, yes. And some of those needs Jana doesn't even know about if that call comes in after 3:30. Jana's done for the day. And so Catch a Ride will be really nice because they advertise that they operate 24 hours a day.
Right.
And then just one other thing, just because it's on my mind, is I'm comparing this, so in the December to end of March, the Waupaca County Catch a Ride had 540 rides, I think it was somewhere around there, so it's much smaller operation than what you guys are doing, but again, as the,
Total? That's a total?
that's their, yeah, 3 months total.
Okay.
Yeah.
Okay.
Yeah.
Great.
But again, picking up, because at that beginning, they were limited to
Right.
where they could drive it to, and then they sort of expanded that to, as they found way they had capacity. So as that capacity continues to expand, I'm hoping even more collaboration
Absolutely.
can happen. I think it'll be
Absolutely.
really valuable.
Word is spreading really fast and it has been really impressive how quickly they've been able to adjust and build and grow. And
Yeah,
it's been really exciting.
yeah.
So
It's
Yeah.
helpful when somebody gives you $3 million, right?
money talks and money can move things quickly. So that was all that I had on Make a Ride. I just wanted to give you guys an update on where we're at with that. Then the last thing that I wanted to talk about is our transportation survey. What I provided you guys today is just a draft. So you guys on Zoom, it is. Yep. Perfect. See, you're gonna be a Zoom expert here, Pat. So I've been looking around at different surveys. There's a lot that you can find on transportation surveys, turns out.
There are.
A lot
Yeah.
of surveys. What I would like to do moving forward, and we started last year with our survey,
I put my
I would like
clothes in.
to continue to do surveys on an annual basis. I want to do surveys on an annual basis at a minimum to check the satisfaction of our service, see how our riders are liking the service and if we're meeting their need. That's the first thing that I would like to know. And the other couple pieces that I think is going to be really interesting is to gather information on what the needs are of of not only our riders, but of the community, of other folks in the community, maybe that we haven't touched yet. So that we can figure out our future planning and what our future needs are and seeing if there's a way that we can meet those needs. So the questionnaire that you guys have is a draft, because I have two different thoughts. One, for a questionnaire to go out to our current riders, our current participants of the program. And also to have questions asked in our connection publication that goes in the buyer's guide. along with having it online as well, having it shared in a couple of different places. Because I want to know the satisfaction information from our riders. But I want to hear from more than just our riders on some of the barriers that other people are experiencing out there. Because our riders tell us part of the story, but there's more information out there that I would like to gather information on. So what I did here in providing the questions for you guys is a sample of what some of those questions could be to get to answering some of those questions that I have. The first question is, have you had difficulty finding a ride to a medical appointment in the last 6 months? And with this one, there are several questions that are like this. To select more than one thing. If you have more than one of these items that applies to you, select all of them that are appropriate for you. I need a wheelchair accessible vehicle. I don't have money for a ride. I don't know who to call to request a ride. My friends and family aren't able to take me. There are no rides available when I call. I can't get a ride at the time I need to go. And a space for them to add in other comments that they may have. The second question, how often are you unable to get where you need to go because of not having transportation? Rarely or infrequently, several times a year, about once a month, more than once a month, once a week, or more often. Next, do you have difficulty leaving your home due to lack of transportation? That I have this is a question you could ask for several different answers. This one I'm having just as a black or white answer, yes or no, if you have problems leaving your home or not. The next one, during the past 3 months, which of the following factors have prevented you from taking trips outside your home? And this is another one asking for them to check all that apply. So this is an example of one that is not specific to elderly or senior transportation because of some of the available options that are here. So this one is definitely one of those questions that's going to be asked to more than just our participants, but is going to be part of that survey that's going to go out to the community. I'm not able to I'm not able to get transportation for not being comfortable driving, or I can't drive. I don't have a reliable vehicle. I can't afford gas or insurance. I don't have someone to drive me. I'm not familiar with transportation options in my area. Do not feel safe when traveling outside my home, and a space for other. So one of the pieces that I want to get more information on, Bill, here is, to your point, who doesn't know about the program? Who doesn't know about their program? And at the end, one of the data points that I want to collect is the person's zip code. They don't need to share their name or address, but their zip code and their age. Those are two pieces that I think are going to be really important as we're collecting this data. Another question, do you currently drive? Yes, all the time. Yes, most of the time. Yes, only a few times a month. Or no, I don't drive at all. The next question, is transportation a barrier to accessing the senior nutrition program, congregate meals, or the Bistro 60 senior dining program? This question is for individuals that are over the age of 60. There will be one more question as it relates to our senior nutrition program, at least one more question. For a total of 2 to 3 questions I do want in the survey as well, because we have a program that's available to folks in the community, but I want to know if folks that want to get to that service are able to do so.
Okay, thank you.
People know about the program and can get
You too,
there.
bye-bye.
Overall satisfaction with the program, that question's pretty straightforward. So I'll move on to the next one. What do you need transportation for the most? I think I know the answer to these questions, but we're still gonna ask it anyway. I'm sure it's gonna be the medical appointments, but I still want to ask the question, even though I think I know the answer. Number 9, are there circumstances when you prefer not to drive? This will tell us a little bit more about the demographics of our people. Is it nighttime? Is it to a destination that's more than 3 miles away? Is it to a medical appointment when I'm not feeling well? Is it on a high-speed highway or a freeway? Or to an area that I don't know very well? Or I don't drive to any destination because you don't drive at all? Number 10, when riding, how friendly or unfriendly was your driver? Very friendly, a little friendly, neither friendly nor unfriendly, not very friendly, very unfriendly. Again, satisfaction question there. The next one, when you're able to find transportation, what activities, when you are not unable to find transportation, what activities do you need to give up? Do you give up work, shopping, community events, medical appointments, social or family events? Other. I think that there are definitely times that people who are not able to drive themselves, there are things naturally that they're going to need to give up. And I am very curious to know what those are, what that looks like. I know we can't do it all, but as we're looking at future planning, future needs, it would be really nice to have this information for future. Number 12, are you able to get to the places you need to go all of the time, over half the time, less than half the time, or never? And the last question is, how would you prefer to get confirmation of your scheduled rides? Asking for just one here. Call by phone, text message, email, or another way. Reason for this question, as it relates both to ongoing satisfaction of the program and for future planning as well. We have a lot of individuals I know that like those phone calls of the reminders. They get a phone call from Jana with confirmation and a reminder of their ride. That is wonderful. But as we're continuing to do more and more and more, there's only so much of Jana to go around. And there's only so much time she has. So what are people's thoughts of receiving confirmation in those other ways? So again, for future planning, so we know what people are most comfortable with. I know, everybody does. Who wouldn't want to vote for Jana? Absolutely. Totally get it. So any questions?
For different 8 and 9, it would be valuable to add other on both of those.
Yep, sure could. That's easy to do.
And the other thing that strikes me on here, a lot of the 5310 and those kinds of funds are going to require an equity component going forward. So if it might be valuable, maybe not in the first one, but eventually to ask either a language question or race ethnicity question, so that you're showing who you're serving in the community.
Good point.
Yeah, because
Race,
you can get
ethnicity, and what was the first one?
race ethnicity or language.
Language.
The other thing might be income, but a lot of that you can get from the zip code and finagle it, but
No, thank you for that. Those are good thoughts.
and would it be valuable if this was done digitally? Because that is something I'm happy to do, is convert this
It sure
to,
could. Yeah, absolutely. If you could help with that, that'd be great.
yeah, send me the Word document.
I'm also wondering about, I haven't ventured out into this, but wondering about a QR code as well.
Absolutely.
Have you ever done any work with QR code?
Yeah, I can send it all over to you.
Okay, that'd be great. There was some talk, I was recently talking with another colleague and they were saying that she didn't realize that the QR code expires, that she only had it for 60 days. So by the time she went to go get the data from the survey, it was past the 60 days, so all of it was gone. She didn't know it had expired, so something to keep in the back of my mind when I'm developing things, I guess. Things have an expiration date. So that's all that I had on that one. So this is going to be a little bit of a work in progress. So as I'm sharing this, again, this is a draft. By the time we send it out, it will have a few questions added to this, and we'll make some of those adjustments and additions as Adam had suggested. I am going to be reaching out to multiple groups, and in doing so, that's going to take some time. I want to see that we can, as we're releasing this to those different groups of folks that were doing that at about the same time. So that our collection time is all about the same.
Can you also somewhere on this, put in like the website?
Mhm.
There's a lot of seniors that don't use a computer, but there's a lot that do. Or they have kids that are more than willing to go out and like get the survey and print it.
I sure can do that. Good suggestion. Easy to do. Great. And then the next agenda item, moving on to the 5-year transportation coordinating plan review. Number one, identify and obtain more affordable transportation options for rural areas. That's something that Jan and I continue to do on a daily basis. Education, marketing, available on the different transportation options. Again, something that is a continual work in progress and more of a focused effort moving forward with Catch a Ride in making sure that we are not duplicating our efforts in advertising and getting the word out there. We certainly don't want to cause any confusion on where people call for requesting a ride. Establish 24-hour affordable transportation options. We're continuing to work with that, as well as healthcare providers and late night discharges. The tandem kind of handoff in this area within the healthcare providers and late night discharges. We're going to continue to have those conversations with Catch a Ride. And in the subsequent meetings that we have with Catch a Ride, I will be asking Jess if he's had a chance to reach out to clinics, hospitals, if they know about their service. Because given how we're set up right now, the 24-hour transportation pickups, we absolutely can help coordinate that with Catch a Ride during our hours of operation. But the problem is when those calls come in or those requests come in when Jana's not here. So we want to do what we can to bridge that time so that there isn't a gap.
I wonder if
during that
that's a
time.
big thing or really not much.
It's, it's something that we haven't ever been set up to do, Carl. So that's a really good question on how often there is that need.
Seems like it shouldn't be too often.
But we don't have people that are coming, that are being discharged from the hospital just from Wapaka here. We've got people from the valley that are leaving the hospitals over there as well.
I receive calls for Wapaka itself and for mostly like the Valley or Green Bay, sometimes Fond du Lac
Mhm.
area.
Mhm.
And it usually is a call like 9 or 10 in the morning or like a 2 o'clock discharge.
Mhm. Giving you plenty of time,
Yeah.
plenty of notice.
Yeah. Of the calls that I receive, yeah.
And to that point, a lot of discharges happen that are prearranged beginning of the day. They're talking about discharge for the afternoon, but those last minute discharges, a lot of times are folks that are in the emergency room
Right.
that aren't going to be saying that test results came back at 2 a.m. You need to go home. We don't have any reason to keep you.
Yeah.
And they don't have anybody to
They
call.
came by ambulance
Yep.
or something
Right.
else.
Right, yes. Okay, so communicate with legislators for additional funding and grants. That is in process as we speak with the advocacy efforts that are going on through the state, through our Committee on Aging, through myself and my staff and many others in the community. We're getting the word out as much as we possibly can at this time, advocating for additional funding for the program. This is the strongest work in advocacy that I have ever seen in my career. I'm very excited and optimistic as to what this budget is going to bring, not just for the transportation program, but funding for older adults in general. There's a lot of talk about just not just transportation, but in a lot of different areas as well. So that is something that is ongoing, but particularly right now is a really hot topic. Working with municipalities to continue expansion of bike and pedestrian transportation. We haven't done any work in that area. Establish a travel buddy program. I know that's been talked about previously. We're not currently. Yes, no.
I'm not sure what you mean by travel buddy program in this instance.
I think that's something that Holly has in Outagamie.
In the Appleton
Oh,
area.
yeah, so if that's what you're referring to, that is essentially having someone ride the bus with you for the
Right.
first time
For
and
public,
learn how to use public transit
right,
that way. I'm trying to think how it would apply here.
I'm not sure.
Like if somebody doesn't know how to call Jana, and then you can connect them with someone to walk them through the steps.
Mhm.
I suppose that would work. But normally it's learning the bus route,
right.
when they talk about
Right.
that.
Yeah.
Yeah. And then going back to the bike pedestrian. Did we talk before about the cycling without age?
In New London,
Yes.
yeah,
Well, it's all over. I mean, but yeah, in New London is.
because
one of
they have the
closest.
bikes. They have, New London has bikes, right?
Yes, well, and there are a couple of other care facilities around the county that have them as well.
Oh, I-
Start in New London.
Okay,
Yeah.
okay.
Yeah,
Yeah, I can absolutely provide an update on that, maybe for our next meeting.
it's super fun,
Okay,
the
okay.
expansion of that. And particularly in the connection to make the ride happen. And how they've been working in some areas to connect. The bikes with transportation, not just recreation.
That'd be great. That also would be good information to provide in our connection publication for the summer.
Holly has some good information.
Okay, I will connect with Holly on that. All right, and then the Transportation Coalition, we are already in process of that with our different groups of people with Make the Ride Happen, Catch a Ride, ourselves being at the table for our monthly meetings where we touch base to talk about our services and help identify and bridge any barriers that we may come across with the services.
And one of the cool additions more recently to that is the Chambers of Commerce. And having them involved in this part of transportation, I think it's so valuable for them to know and have them, just that word get out in those circles. Where they used to think it wasn't their issue,
Right.
but now we're seeing in the rural areas particularly, we need that.
Absolutely, absolutely.
Yesterday in finance, we voted to join the Alpaca Chamber of Commerce.
Oh, really?
It'll come to the full board next week.
Wow, that's exciting. Is that the first time?
Yes.
Exciting. Awesome. Huh. That's
So
cool.
if there's any overlap with
Mhm,
cooperation with services.
mhm. I definitely think that there's a lot of opportunities there for us. Definitely. That's great news. That was all I had. Any questions?
Okay. Our next meeting is the 13th of July. And you'll probably all come with your shorts on and tank tops and
I hope not a sweater.
tank tops and 50 sunscreen.
We'll get to that one with you.
Carly, you want to make a motion to adjourn?
Yeah, I'll make a motion to adjourn.
I'll adjourn.
Sunscreen today, right now.
What's that?
You need a little sunscreen today.
Yesterday was after that.
Yeah.
Sundays.